Today's topic is nasal trauma or nasal injury. We will see the effect of nasal trauma and how to manage. Okay. The clinical features. So whenever there is an injury to the nose, what are the clinical manifestations of the injury or trauma? So these are swelling of nose, pretty obvious. Periorbital ecchymosis. That means periorbital area means area around the eyeball. Okay, around the eye area. Orbit is where the eyeball is inserted. Okay, so orbit is the cavity where eyeball is inserted. So periorbital area means the area around the orbit. So and ecchymosis means collection of blood. Okay, collection of blood, and sometimes this blood turns bluish in color. Okay, so periorbital ecchymosis, tenderness. Obviously, whenever there is injury, there would be tenderness or pain on touching. Okay, nasal deformities. If the blow is huge enough, then what will happen? Then it would deform the shape of the nose. Okay, the shape of the nose will be deformed due to fracture or due to any other what to say, any other conformational change in the shape of the nose. Okay, crepitus and mobility of fractured fragments. Whenever there is a fracture, see, nose is not a very big organ, so it is a small organ, and whenever there is fracture, there would be small fragments of the bones, of the nasal bones, and those small fragments would be displaced. So along with fracture, there will be displacement of the fractured pieces of bones. So that is known as crepitus and mobility of fractured fragments. Okay, epistaxis. We have already seen that epistaxis means nasal bleeding, nasal obstruction. Obviously, if the shape of the nose is changed or damaged by trauma or by injury, then what will happen? The normal shape is not maintained, then it would cause obstruction or blockage in the passage of airway. Okay, so that's how it would lead to nasal obstruction. Next is nasal laceration, like bone and cartilage will be exposed. The muscular part of the fleshy part of the nose would be injured badly. Okay, and this would expose the bone and the cartilage of the nose. Okay, so what are the clinical features? Let's go through once. These are swelling, periorbital ecchymosis, tenderness, nasal deformities, crepitus and mobility of fractured fragments, epistaxis, nasal obstruction, nasal laceration, where the bones and the cartilages would be exposed. Okay, so these are the clinical features we can see whenever there is a trauma or injury to the nose. Diagnosis. How to diagnose where there is a trauma in the nose? Number one is physical examination. That means whenever the patient comes to your clinic or whenever the patient is presented to you, you will first examine the patient physically, and just by looking at the patient, you can understand that there is injury or there is trauma. And obviously, physical examination includes taking history. The patient would tell you that he or she has undergone this type of blow, maybe due to fighting or maybe due to accident, or he has fallen onto the rocky surface or something like that. That type of history would be presented to you. Okay, so there would be a history of falling or accident or fighting, those kind of incident. Okay, so and by for the other clinical features like tenderness and pain and ecchymosis, you will have to touch whether there is pain or not, and you'll ask the patient whether he or she is feeling pain or not. And for ecchymosis and all, you'd inspect the patient. By inspection technique, you would examine the patient and get those clinical features and jot them down. Okay, next is whether there is a fracture or if if there is a fracture, what kind of fracture and how much is the extent of fracture, what are the bones that have undergone the fractures, etc. Those can be derived from X-ray only. Okay. So X-ray would be done, and the specific views which are useful in case of nasal trauma, these are Waters view and right or left lateral view. So this Waters view is very important with respect to MCQ. Okay, so Waters view and right or left lateral view. This right or left depends upon the site of injury. Okay, so X-ray would be done, and sometimes the CT scan might also be needed. Why? Because if there is the fracture of the cribriform plate of the ethmoid bone, then there will be CSF rhinorrhea, and CT scan is very useful to view that whether the cribriform plate of the ethmoid bone has fractured or not. And if there is the fracture of the cribriform plate, there would be CSF rhinorrhea. So by inspecting the patient, you can see whether the patient is having rhinorrhea or nasal discharge or not. Okay, so whenever there is a presence of nasal discharge, you order a CT scan for the patient. So what are the diagnosis of this patient with nasal trauma or physical or nasal injury? These are physical examination, X-rays, and what are the views of X-rays? These are Waters view and left or right lateral view depending upon the site of fracture. And CT scan is needed, especially when there is nasal discharge. So see, this is the X-ray. This is the lateral view. This is the lateral view of the nose, and here is the fracture. Okay, you can see here is the fracture. Okay, and you can appreciate that there is a potential swelling in the nose. That is why the shape of the nose has been changed. See, this has become like a dome shaped. So this has become like a dome shaped organ. Okay, so this is because of the swelling, especially the muscular part of the nose has been swollen. Okay, since here there is less muscle here, so the extent of swelling is less here. Since here the muscle or the flesh portion is more, that is why the swelling is more here. So this due to this swelling, the shape of the nose has become a dome shaped. Okay, and here is the fracture, and you can appreciate that this part is the bony part. This chalky white or bright white portion is the bony part, which is being showing as bright white in the X-ray. So this is the bony part, and this is the cartilaginous part. That is why this is not so white or not so opaque. Okay, and here is the CT scan of the nose, CT scan of the brain, and here you can understand that this portion, this is the corresponding CT of this patient, and this portion has been fractured. You can understand this portion. This portion. Okay. Next is management or treatment. Number 1 is observation. Number 2 is closed reduction, and number 3 is open reduction. Open reduction means we have to open the patient. That means we have to surgically intervene the patient. So this is known as open reduction. So whenever there is the extent of fracture and the displacement is huge, then it cannot be managed by closed reduction alone. So then the surgical intervention is needed, and the cavity needs to be open, and then we have to fix the fracture, and then we have to stitch it up again. So this is known as open reduction and internal fixation. Open reduction and internal fixation, or ORIF. Sometimes in the question you might find that ORIF, the patient has been sent or has undergone an ORIF or ORIF. So that means open reduction and internal fixation. So indication for closed reduction. Okay, So indication for close reduction means when we do not need a surgical intervention. Okay? Unilateral or bilateral fracture of nasal bone displacement. Okay? Next is fracture of the nasal septal complex causing nasal airway compromise. Close reduction can be performed under local or general anesthesia. Presence of edema interferes with accurate reduction by closed method. Best time to reduce a fracture is before the appearance of edema or after the edema subsides. So usually this is 5 to 7 days after the trauma has taken place. Next is reduction is difficult after 2 weeks due to natural fracture healing. So this is during this closed reduction. If there is this closed reduction is not a very severe surgical procedure. This is a small or semi-surgical procedure where you don't have to open the cavity. Okay, so you will reduce the fracture from outside. So this is known as close reduction. And if there is excessive swelling or edema, then the reduction will not be accurate. So the best time to reduce the fracture, the best time to intervene the patient with close reduction is either before the appearance of edema or after the edema subsides. That means after the edema or the swelling disappears. So usually it takes 5 to 7 days after the occurrence of the trauma. So after 5 to 7 days, when the edema will subside or when the edema will disappear, then you can reduce the fracture. So if there is a delay, if there is a long delay after the fracture or after the trauma, like 2 weeks or 14 to 15 days, if that period has been exceeded, then what happens? Then there will be osteocyte formation. The fracture will be healed naturally, but the fracture will be healed naturally. That means there will be ossification or new bone formation, but the shape will not be proper. That is why we need to reduce a fracture properly. We need to fix the broken pieces onto the proper place, and then we need to fix it, like, and sometimes we need to immobilize it with screw or with applying cast, etc. But in nose we don't apply any cast. We just reduce the fracture and apply a bandage. Okay, so that is how we immobilize the movement of the fractured fragments. So here, if there is 2 weeks or beyond 2 weeks delay in the reduction, then the reduction does not become effective. Okay, so the fracture is healed by natural process, but the shape or the positioning of the broken fragments are not proper. So the nose will be permanently deformed in that case. So the best time to reduce the fracture in closed method or in closed reduction is either before the appearance of edema or after the disappearance of the edema. And it takes 5 to 7 days to disappear the swelling or the edema after the trauma has taken place. So this one we have to remember. Okay, best time to reduce a nasal fracture. Next is indications for septorhinoplasty. Septorhinoplasty means the surgical repairing of the nasal septum. Okay, the delayed presentation for more than 3 weeks post trauma should be treated with septorhinoplasty once the fracture has healed, like, or 6 months post trauma. Poor outcome after primary management. So these procedure, this septorhinoplasty is an open reduction. Okay, this is an open reduction method where we surgically intervene the patient and repair the nasal septum. Okay, nasal septum and the associated or related parts. Okay, so when there is 3 weeks have lapsed from the date of trauma and it has not been repaired or it has not been given any intervention like closed reduction or anything like that, then we need to go for septorhinoplasty. Or if the primary reduction procedure, or if the primary closed reduction has failed or has shown poor outcome, then we will have to go for open reduction and internal fixation by this septorhinoplasty method. Okay. Next one is the presence of a significant hematoma requires drainage. Hematoma is diagnosed as follows. So when there is a significant hematoma, that means collection of blood, and that stagnant collection of blood needs to be drained, otherwise there would be infection. Okay. So there is clotted blood, a collection of blood in the nose area, so that needs to be drained. Okay. So hematoma will be diagnosed as, the main symptom is severe nasal obstruction. Whenever there is any collection or any unwanted built up of any body fluid, there would be obstruction in the passage or blockage in the passage. So whenever there is hematoma, there would be nasal obstruction. The patient will not be able to breathe properly, and her nose will be, he or she will be feeling fullness in the nose. Okay. Next is, on examination, the septum appears swollen and boggy. Obviously, if there is potent hematoma or potent collection of blood, the septum would be swollen and heavy. Okay. Next is, the swollen area should be palpated with a cotton tipped applicator. If a hematoma is present, it should be compressible. So we will take a cotton bud like swab type of stick, where the head of the stick would be wrapped with cotton, and we will try to touch the hematoma and feel the feeling. If there is hematoma, then it would be compressible and it would be very soft and tender. Okay. Then by that feeling only we can understand that there is a hematoma. So that is how hematoma is diagnosed, and it would be drained. Okay, so this is all about nasal trauma. Now we will see acute sinusitis. So as the name suggests, sinusitis, this is an inflammation of the sinus due to the collection of fluid in the sinus. Sinus is basically a hollow space. Hollow space is known as sinus or coelom. Okay. So in case of higher animals, this is called as sinus, and in case of lower animals, these are called as coelom. These are hollow space inside the body. And since this is acute sinusitis, this is the course of the disease is short. Okay, if the course of the disease is prolonged, then we would call that as a chronic one. Okay. So the pathogenesis, or the mechanism of the disease is, basic cause is osteomental complex infection and inflammation. Okay. Now what is the osteomental complex? This is the middle mental region and the frontal, ethmoidal and maxillary sinus ostia. So if this area is infected or inflamed, then it would lead to the inflammation of the related sinus. So we will have to check which area is damaged, and depending upon that, the nearest sinus or sinuses would also be inflamed, leading to the acute sinusitis. Okay. Next is an ostia means whole. Okay. Ostium means a whole, and ostia is the plural of ostium. Okay. So sinus ostia means the aperture or the outlet of the sinus. Okay. Next is sinus ostia occluded. That means the outlet of the sinus is obstructed or blocked. Colonizing bacteria replication, ciliary dysfunction and mucosal edema. So if there is bacterial proliferation in the sinus, etc., in the sinus or any peripheral region of the sinus, then there would be that would lead to the inflammation of the sinus and also infection of the sinus, causing sinusitis. Ciliary dysfunction. The nasal cilia, the nasal cilia, if they cause dysfunction, then that would lead to the function of the cilia is to condition the air. So if the cilia are not functioning properly, then this would lead to lots of pathogenic organism to enter in the nasal cavity, and that would obviously cause infection and inflammation as well. So the sinus will be inflamed and there would be sinusitis. Next is mucosal edema. If there is a long-standing edema, then the stagnant fluid would cause inflammation. Okay, so the sinus would again be inflamed, causing sinusitis. So these are the basic pathology or basic pathogenesis of sinusitis. Next is predisposing condition. So what are the conditions that lead to the causation of sinusitis? Number one is local, number two is systemic. Among the local predisposing conditions or local predispositions, there are upper respiratory tract infection, allergic rhinitis, nasal septal defect, foreign body inside the nose, dental infection, nasal polyps or tumors, overusage of topical decongestant, etc. So among these, we have to remember this dental infection very deeply. So why? Because in the question it is often given that which of the following conditions cannot lead to acute sinusitis, and there would be dental infection. So usually if the student does not know, so he or she will be ruling out this dental infection, but we have to be careful while answering this, because we already know that these dental infections can lead to the causation of sinusitis. Okay, so next one is systemic predisposing conditions. These are diabetes, immunocompromised state such as AIDS, malnutrition, etc. So these are some general conditions where the basic immunity is low. That is why the pathogenic organism can easily invade and cause infection in the sinuses and the associated or related areas. Okay. Next is the clinical features or the clinical manifestations. Their symptoms progress over 2 to 3 days. So after the sinus gets inflamed or starts to get inflamed, the symptoms take 2 to 3 days to develop. Next is nasal obstruction or nasal blockage. Discharge, usually thick and colored, not cleared or pus. So the discharge of sinusitis is obviously the nasal discharge of sinusitis is not clear and transparent, but rather very thick and colored. It is not clear. It is either thick, colored, or it is pus filled. That means the production of pus will be there due to infection. Okay, next is headache or localized pain. So depending upon the site of the sinus, there would be localized pain above the sinus, above the inward sinus, or there would be headache, like in case of frontal sinus, subfrontal sinusitis, or ethmoidal sinusitis, etc. there would be headache. But in case of maxillary sinusitis, the pain would be above the maxillary sinus only. Okay, cough, especially after receiving nasal drip. So whenever there is a nasal drip applied to relieve the sinusitis, to aid the sinusitis, there would be presence of cough, or there would be the cough would be evoked. And halitosis. Halitosis means foul smelling breath. Okay, so these are the symptoms and signs of sinusitis. Okay, these keep on varying depending upon which sinus is involved. Okay, so here first of all we see the symptoms of maxillary sinusitis. Number one is unilateral pain over the cheekbone. So over the maxilla, the pain is localized. Okay, since maxilla is basically over the cheekbone, that is why on the two sides of the nose over the cheekbone. Okay, so this is the place of maxilla. So there is pain over the cheekbone or pain over the involved maxillary sinus. Maxillary toothache. So the involved area, in the involved area, the tooth is there. So that tooth will also be associated with pain. So there would be pain in the involved tooth also. Next is temporal headache. So there would be a headache in the temporal region. Pain worsens if head is held upright. Pain lessens if the head is kept at supine position. So these two are very important, and often this is mentioned in the question, like the pain of the patient is worsening when he or she holds the head in the upright or erect position, and the pain is relieved when the patient lies down at supine position. So by this we have to suspect a maxillary sinusitis. Okay, so this is the picture of maxillary sinusitis. This is the X-ray, and see these two areas are maxillary sinus, and this shadow portion, this indicate what? This indicates the presence of fluid in the sinus. So fluid is radio opaque, so that is why this is shown as white shadows. Okay, so if the sinus was empty, then it would have been shown black, okay, or radiolucent. Since air is radiolucent, so it would have been shown black if this sinus were empty. But since both the sinuses are filled with fluid, that is why these are shown as white portions, or white shadows, since fluids are radio opaque. Okay, and this is the nasal shape. This is the nasal septum. These are the teeth. So whenever there is maxillary sinusitis, these teeth will be involved in pain. So there would be pain in these teeth. Okay, this is the site of frontal sinus. This is ethmoidal. This is sphenoidal. Okay. Next is ethmoidal sinusitis. Here medial canthal pain, medial or periorbital or temporal headache. Here the temporal region is this part. Okay, this part diagonally above the eyeball. Okay, lateral part of the eyeball or lateral part of the orbit. So this portion is known as the temporal region. Okay, so if whenever there is maxillary sinusitis, there would be temporal pain in the involved at the site of the involved maxilla. And if the maxillary sinusitis is bilateral, then there would be bitemporal headache. Okay, here and here. Okay. So medial canthal pain, since the ethmoidal sinus lies here or here. Okay, at the medial side of each orbit. Okay, so that is why the pain remains in the involved area. So here there would be medial canthal pain. Okay, medial canthal pain. Canthal means canthus of eyes. These are called canthus of eyes, and this portion is called canthal region. So medial canthal pain would be there. A medial and periorbital or temporal headache would be there. So either the pain would be medial or periorbital pain. So medial orbital pain or periorbital pain, that means pain around the whole orbit at the side of the involved ethmoidal sinus. Okay, so there might be medial or periorbital pain, or there might be temporal headache at the side of the sinus, involved sinus, or if the sinusitis is bilateral, that means here and here also, then it would be the pain would be pain would be bilateral. That means the here also and here also it would be there. In this picture, which side is involved? Which side is involved? See, this portion is black. Okay, that means this is radiolucent. That means it's not filled with any liquid. And this portion is opaque. That means it is fluid with some radio-opaque fluid. And this portion is this sinus, this ethmoidal sinus is filled with fluid. So this area is involved. Okay, so this portion is undergoing sinusitis, or here we will say that this ethmoidal sinus is having inflammation, or this one is inflamed. Okay, so this is the also this portion, this maxilla, this left maxilla also. So this is in this left axilla also, left maxilla also, there is collection of fluid. There is radioopaque fluid, whereas the right maxilla remains black or radiolucent. So this side is unaffected, and this side is, in this side both the ethmoidal sinus and the maxillary sinus are partly filled with fluid. Also here also sphenoidal sinus is also partly filled with the fluid. So whole portion, like the maxillary sinus, the sphenoidal sinus as well as the ethmoidal sinus, are having sinusitis. Okay, here. So these are the teeth. This is the nasal septum, and these are nasal conchae. Okay. Next is sphenoidal sinusitis or sphenoiditis. So in this case, there would be retroorbital, temporal or vertical headache, deep-seated headache with multiple foci. Pain worsens with supine and forwardly bent position. So here the the pattern of the pain is just the opposite of this one. Okay, so here the pain was less at supine position. Here the pain is more in supine position. Okay, so this one we have to remember. Okay, next is retroorbital, temporal or vertical headache. So here these are the orbits. Okay, this is the nasal septum. And this is the temporal region. This one and this one. Okay, this one and this one, these are the temporal region. Okay, and this is sphenoidal sinusitis. Here this is the sphenoid or sphenoidal sinuses. This one and this one, this is the ethmoidal sinuses. Okay, so these two are the sphenoidal sinuses, and here there is more fluid and here there is less fluid. Okay, so this is the characteristic of sphenoidal sinusitis. Deep-seated headache with multiple foci. So there would be multiple directioned headache. Okay, and the pain would be either retroorbital, that means around the orbits, or temporal, here, or vertical headache. Since this sphenoidal sinus is here, the pain, if this region is involved, there would be pain in this region as well. So there would be vertical headache. See, in this city, you will understand it in a better way. So sphenoidal sinus is where? Here, and here. So if these portions are involved, then the pain would be felt as this way. So this portion would be paining, or this portion would be aching. So that is why this is known as vertical headache. Okay. Next is frontal sinusitis. So frontal headache in the frontal bone. Frontal bone is a facial bone. Frontal bone is a facial bone. Okay. So if the frontal sinus is involved, then there would be pain over the frontal sinus, and pain would worsen at supine position and pain lessens if the head is held upright position. So all these features where the pain is worsening and where the pain is relieved, we have to remember. Okay, so these are the orbits and this is the frontal sinus, this one and this one. See, this one is left with some black area still, but this one is completely filled with fluid. So this area is this sinus is more this sinus is filled with more fluid, and so this one is having a more severe sinusitis or more severe frontal sinusitis. Okay. Diagnosis: CT scan with coronal view and X-ray. So this CT scan is, this view is known as coronal view. Okay. And X-ray. Usual physical findings: congested and edematous nasal mucosa. So whenever there is sinusitis, there would be congested and edematous nasal mucosa. The nose will be filled up. So sometimes it is confused with common cold, but this is by radio imaging we can understand that this is not common cold or flu. This is basically sinusitis. Purulent secretion in the middle meatal area. This may be absent if the ostia are completely blocked. So there would be purulent secretion. That means pus would be there in the middle meatal area. Okay. Percussion tenderness over involved sinus, maxillary, molar or premolar teeth. So if you perform a percussion over the involved sinus area, then there would be tenderness. Then the patient would feel pain. Okay, on touching or on while performing the percussion test. Next is even maxillary, molar or premolar teeth. If you perform percussion over these area also, the patient will feel pain. So there might be fever, since this is a characteristic of inflammation. So there might be fever as well. Next is treatment. Number 1, this is antibiotics for 7 to 14 days. So depending upon the severity of the sinusitis, we might have to administer antibiotic. Nasal decongestant and topical corticosteroid. Nasal decongestant will help the patient to relieve from the congestion, and topical corticosteroid would drain out the fluid. Okay, so the edema would subside and the fluid collection would be alleviated by this topical corticosteroid. Topical means local. Nasal irrigation. Nasal irrigation means nasal drainage. Postural drainage. So in certain posture, if the patient maintains a certain posture, then there would be a natural drainage due to gravity. So this is known as postural drainage. Puncture and irrigation of the maxillary sinus. So sometimes we need to do a drainage of the maxillary sinus by puncturing and performing the drainage, or this is also known as incision and drainage, or IND. Next is admission in hospital and treating accordingly. So if the patient is very serious, if one or more sinuses are involved and there is high production of pus, etc., and there is serious infection as well, so in those cases we need to admit the patient in hospital and indoor treatment is preferred. Next is chronic rhinosinusitis and nasal polyposis. So this is basically a sequel of acute rhinosinusitis or acute sinusitis. If the sinusitis is not managed properly, or if the sinusitis is left untreated for a long time, then it would progress to chronic rhinosinusitis. Okay, and sometimes this rhinosinusitis is accompanied by the formation of polyp in the nasal cavity. So this is known as nasal polyposis. Osteomental complex, as we have already seen, that this is the area, middle meatus area, and the frontal, ethmoidal and maxillary sinus ostia. So this portion is known as the osteomental complex. The cause or the etiology of the chronic rhinosinusitis are allergy, seasonal allergy or perennial allergy. Perennial allergy means non-seasonal allergy, or which the allergy, the type of allergy which remains constant with irrespective of the season. There is no seasonal variation. Okay. Next is immunocompromised state, when the immunity is low. Structural, deviated nasal septum, hypertrophic turbinates, etc. So when there is deviation in the nasal septum, or there is hypertrophic turbinates, nasal turbinates, then it would favor some pathologic organism to invade the nasal cavity and cause infection. So in this way, the structural deformity can lead to the formation of acute and later on chronic rhinosinusitis. The classification of chronic rhinosinusitis. There is chronic rhinosinusitis or simple chronic rhinosinusitis, and chronic rhinosinusitis or simple chronic rhinosinusitis, and chronic rhinosinusitis with nasal polyposis. Chronic rhinosinusitis, the causative organisms are anaerobic. Among the anaerobic bacteria, there are propionibacterium, bacteroids, and peptococcus. Okay, so these are the anaerobic bacteria, and among the aerobic bacteria, there are staphylococcus, corynebacterium, and pseudomonas. And among the fungi, or among the fungus, there are aspergillus, fumigatus, carnivularia, and Dresseleria. Okay, so these are the fungus which can cause chronic rhinosinusitis, and these are the aerobic bacteria. These are the anaerobic bacteria causing acute and subsequently chronic rhinosinusitis. Next one are the clinical features. So there are some similar symptoms with those of acute rhinosinusitis. Okay, so these are nasal obstruction and blockage, nasal discharge, purulence, post-nasal drip. So here the discharge are almost always purulent, or there is always a formation of pus accompanied with the sinusitis. Okay, in the acute rhinosinusitis, there might be non-purulent discharge as well, but since in chronic rhinosinusitis, since the course of the disease is prolonged and the disease has worsened in degree. Okay, so here the discharge is almost always purulent, especially post-nasal drip. Next is when the nasal drip is applied, due to the blockage or obstruction, it is not irrigated, or it is not channelized properly due to the blockage. So that is why there would be discharge. If nasal drip is applied, it would backflow and come out of the nasal cavity. Okay, so this is known as the post-nasal discharge. Next is hypoosmia or anosmia. Since there is blockage, there would be disturbance in the smelling sense or olfactory sense. So there might be less sense or hypoosmia, or there might be complete absence of the smelling sense or anosmia. There might be headache, that is quite obvious. If the sinus is inflamed, it could obviously cause headache, and that there might be dental pain in the involved area which is nearest to the sinus. Okay, if there is, and dental pain is most common with maxillary sinusitis, since The maxilla is the nearest sinus to the teeth, to the dental area. Okay. So the next we will take a summary of the sinusitis. Okay, sinusitis is common but overlooked. Sinusitis is often remains untreated because they don't get medical attention. This is regarded as normal headache or normal toothache. Okay, so nobody goes for a mild pain or mild headache. Nobody goes to the doctor. Okay, so that is why it remains overlooked or untreated. It causes various and complexities. Sorry, causes is various and complex. So there might be many reasons which can lead to the causation or which can lead to the development of sinusitis, and the causes are complex in nature. That means there are complicated or complex pathology of the rhinosinusitis. Okay, treatment of subsequent follow-ups are treatment and subsequent follow-ups are very important. Medical management is effective in most of the cases. Functional endoscopic surgery is helpful in resistant sinusitis. When the sinusitis remains untreated or when the sinusitis remains resistant or is not responding to the medicinal treatment for a long time, then we might have to go for endoscopic surgery to drain the sinus properly or to manage the sinusitis properly. So in the endoscopic sinus surgery, we have already seen this as an indication of ESS or endoscopic sinus surgery. So this is just a recap for us. Next up, nasal polyps. So polyps are kind of mass. Okay, kind of mass. They are they are kind of pedunculated mass. Okay, and what type of, they're like buds. Okay, and pedunculated mass. So these are all types of polyps inside the nasal cavity. See this one is highly pedunculated. So this one also polyps. Polyps are very common actually. Okay. Here we can see that it has become purulent. So pus-filled. Purulent or pus-filled. The most common presentation of nasal polyp is snoring while sleeping. Okay. Since there is polyp, there is obstruction in the airway. So the person when sleeps, he or she snores. There is production of sound. Okay, nasal polyposis, the prevalence of nasal polyps are 2 to 4%. Asthma in approx 40 to 65%. That means asthma is common among those having nasal polyposis, and the prevalence of asthma among the patient with nasal polyps are 40 to 65%. Aspirin sensitivity in 10 to 15%. So those patients who are having nasal polyposis are supposed to have aspirin sensitivity, and that accounts for around 10 to 15%. Mixed cellular infiltrate with prominent eosinophilia is present in around 90% of patients. Okay, this eosinophilia is a characteristic feature of allergy. Whenever there is allergy, like which is also very common with asthma, so there would be eosinophilia or high number of eosinophil in the blood. Okay, next is inflammation with local IgE production. See, all these eosinophilia, local IgE production, etc., and asthma, these are all related with IgE. So we can correlate and remember. Treatment of rhinosinusitis. Number 1 is long-acting nasal decongestant. This can be applied twice daily for 7 days. Application of nasal irrigation device. We can drain the nasal cavity, or we can drain even the sinus through the nasal cavity by device. Okay, next is antibiotics in long-standing cases, and those cases where infection is accompanied, topical corticosteroids, and sometimes we might be needing surgery. Okay, this would be number 5. Okay, surgery. Next is treatment of nasal polyposis. If the sinusitis is accompanied by polyps, nasal polyps, then we would treat that with nasal corticosteroid first to reduce the fluid in the related area or edema in the related area, oral corticosteroid, antibiotics, antifungal medication. Why? Because this sinusitis or polyposis can also be caused by some fungus, as we have already seen in the etiology. And if all these managements are not responding properly, then we would go for surgery. Next is neoplasms of nasal cavity and related regions. What is a neoplasm? Neoplasm is kind of tumor or a growth. Neoplasm, neo means new and plasm means growth. Growth or plasm means mass, etc. Okay. So whenever there is a new mass formation or new growth formation, it is known as neoplasm. Neoplasm can be benign and neoplasm can be malignant or cancerous. Okay. So we will see some neoplasms in the nasal cavity and related regions and their features and managements as well. Number 1 is squamous papilloma. This is very common. In this is a verrucous lesion similar to skin warts. The appearance is like skin warts. Nasal vestibule or lower part of nasal septum are involved. This can be single or this can be multiple in number. This can be pedunculated or with a stalk, and this can be isolated or without a stalk. See, this is the histopathological view of an inverted papilloma. Okay, here this portion shows growth. This portion shows growth, and this is the characteristic feature of papilloma. This kind of wavy appearance. Okay. Or this one is the physical image of this papilloma. Okay, this is like a wart, a skin wart. This is known as papilloma. This one is pedunculated. Okay, inverted. Inverted means the peduncle or the stalk is above and the mass is hanging below the stalk. Okay, this is an inverted papilloma. Next is hemangioma. Hemangioma can be capillary or can be cavernous. In hemangioma, there is presence of blood. Okay, this can be in capillary hemangioma. This can be soft or dark red in color, and this might be again pedunculated or sessile or in the nasal septum. Next is cavernous hemangioma. It can originate from the turbinates and it can be managed by excision and preliminary cryotherapy. So cryotherapy can be done in case of this cavernous hemangioma. Cryotherapy means therapy with liquid nitrogen. Okay. Next is extensive lesion radiotherapy and surgery can be done in case of hemangioma, and bleomycin injection can be administered to manage hemangioma. So this is a hemangioma. This one is formed at the laterals, at the medial side of the nasal septum. Lateral side of the nasal septum. Okay, this is the hemangioma. Next is osteoma. This can be formed most commonly in the frontal sinus and can be formed in ethmoidal or maxillary sinus as well. And this is asymmetric. So this will not be bilaterally symmetrical. Okay, so this would be asymmetric. So see this one. This one is the osteoma, because this one is black or empty sinus. This one is filled with opaque, radio opaque part, and this radio opaque part is nothing but a mass. Or in the mass or neoplasm, what happens is that the content of the neoplasm is radio opaque. That is why it is shown as white in the CT. Okay. So this is all about neoplasms of the nasal cavity and related organisms.